So, who is the one you need to assess for checklist for autism spectrum disorders? Is basically the child 3 years old, 4 years old, 5 years old who are speech delayed. Yeah, the speech delay group is the one that really need to sit down with parents and ask properly the history, go through the checklist whether the child is autistic or not lah. Because one of the most common complaint with child with autism is speech delay lah. If you go through and then see there is no features suggestive of autism spectrum disorders, then that's when you can say patient is having isolated speech delay if the other developmental domain is normal. If patient also have other domain in the development domain also abnormal or delayed, then patient fall under category of global developmental delay lah, which is you need to work out further lah what is the cause of the global developmental delay. If we talk about autism based on the DSM-5 criteria, there are two main domains that are affected in patient with autism. First domain is the social communication and interaction, and second domain is restrictive and repetitive patterns of behavior lah. For the first domain, you need to have 3 out of 3 criteria to be fulfilled. For the second domain, which is the restricted repetitive pattern of behavior, it needs to be 2 out of 4 to be fulfilled to say patient have autism spectrum disorder. Okay, so if we go through the first domain, the social communication interaction problem, the first criteria is difficulty in social emotional reciprocity, which is basically in a simpler term, trouble with back and forth conversation lah. So it's very difficult for parents and for the child to have a meaningful conversation, and very difficult for the parent or other people to engage with a child. So need to call them many times. When you ask them something, they don't reply. So there is no back and forth conversation lah. Alright, so the second part of the social communication interaction is basically challenges in non-verbal communicative behaviors lah. So what it means, there is difficulty or understanding non-verbal cues, and there is poor eye contact lah. So non-verbal cues that include your gestures, your shrug like this, that indicates especially you don't know, they have difficulty doing that. They don't have head shaking in a correct context. Kalau we ask something they don't know, you shake head, right? But in a child with autism, they don't really have the understanding. Shaking head is saying things they don't know. Okay, and then also limited eye contact. Sometimes the eyes fleeting. There is some eye contact, but the eye contact very brief. And then some of them, the severe one, don't even have a proper eye contact. So fleeting eye contact also falls under the category of limited eye contact as well. Okay, and then for the third part of social communication interaction, basically difficulties in maintaining, developing, understanding relationship lah. So in a simple word, basically they have problem in making friends, okay, or maintain their friendship lah. So they don't, if you see a normal child how they behave, even at different places, the tendency to go and make friends is there. So they just probably say hi if the friendly one, but even the shy one, they looks interested. They kind of like focus on certain child. Even if they're shy, they have the initiative to go and play even though they're shy. Then after given time, they will probably get connected and play together lah. So in autistic child, they have problem with that. Some of them looks like they wanted to join the play of other children, but we have to really see properly whether they're really interested to join and play together, or whether they're just interested in the item or things that the other child is playing. So to parent, it may looks like the child is looks like they want to join, but basically to us, if you ask properly, they probably just wanted to have the thing that the other children is playing. So yeah, in this context, it's very difficult to assess, so you need to ask properly, and then it's best to assess them yourself when patient in the clinic lah. Okay. Furthermore, to add on the social communication and interaction, not to say every autistic child will have all these component. Like I said just now, limited gestures, they will some of them can use gestures, but the quality is important. The quality of the gestures, when you normal child pointing at something, they point at you and they look at the parents, that like they wanted the thing that they're pointing. So yeah, that's the quality of it lah. I mean, using gesture as communication channel to communicate with parents. If they point at something and they look at you with good eye contact, showing their eagerness, their want, that they wanted certain things, that and then parent could understand properly. But in autistic child, the quality of it, they can still point, but the way they point, they don't really use the eye contact to the parent to show the thing that they really wanted. So the lacking of the gesture also important to assess, so that you know lah. Because most of the parents will say that child is using pointing, using gestures, but for us, we need to really understand them. We need to assess properly whether the child is really gesturing properly and or not. Okay. Next component is the restricted repetitive pattern of behavior. It need to be 2 out of 4 to say patient have enough autistic features, including the 3 out of 3 of the first domain. So what is the 4 criteria under restricted and repetitive behavior? So the first component is stereotype or repetitive movement, use of object or speech. So in a simple word, basically there is a repeating movement of phrases, the thing that they say, movements like hand gesture, flapping, all those things. Those are some of the feature of repeating movement of the phrases. The phrases they keep repeating over time and time again, even out of context, something they pick up when they watch some cartoons and all that. They keep repeating it without any context, of communication with others. They just saying it out of the blue. Okay, so and then for the second component under restricted repetitive pattern behavior, the insistence of the child on sameness on certain routines and ritual, and then when there is changes, it will cause distress. Okay, in a simple terms, they need things to be done in the same and follow the same routine. Okay, if you change it, they will kind of distress. So they need certain plate to be at this certain colors. If not, they won't eat. They need to go and brush teeth first, and then do this first and do that after in specific order. If you change the order, they will be distressed. Okay, alright. For the third part, basically is the highly restricted interest. So there is a strong focus and specific topics and object. So in a simpler term, they are having a very focused interest, and sometimes to the point of obsession. If you see the type of cartoon they watch, it will be the same cartoon over and over again, and the thing that they play, if they only obsessed with certain things, they won't be interested in other toys. For example, if they like cars, it's just cars. If like planes, it's just plane. They won't be interested in other things. Okay, alright. The last component of under the restricted and repetitive behavior is basically the sensory sensitivities and unusual interests in the sensory aspect of environment lah. So in this context, it could be the fascination with certain texture, fascination with certain lights, or in simple term, other thing, in a simpler thing, they also have unusual reaction to sensory. So for example, sensory issue, they have very difficulty to cut their nail, they have a lot of difficulty to cut their hair, because they have problem with sensation. They just cannot feel or hear certain things. All right. uh, so you will see this behavior, and they cannot hear certain loud noise. It will distress them a lot. Okay, so out of this repetitive restricted pattern of behavior, it only need to be 2 out of 4 to say it's positive lah. If already 3 out of 3 under the social communication issue. So more of additional point, basically the symptoms of the children with this social communication impairment and the restricted repetitive behavior. The symptoms should appear in early childhood. It shouldn't appear later in school going age and all that lah. It should appear with around 2 years, 3 years of age. Some of it may disappear, may improve later once they cope. Once they are coping better, they kind of like coping better, they can control their symptoms. But when you ask the parents, the symptom was there already since the beginning lah. And then this behavior, this social communication issue affect their daily life and functioning. And then the symptoms should not be explained by another condition, because certain condition like certain syndrome will have some autistic features as well. If that's the case, then you shouldn't be making autism spectrum disorder. It's like more of that certain syndrome with autistic behavior. That should be the case lah. Okay, so why is it important to diagnose child with autism? Because they have problem communicating. So when you have problem communication, it's already a problem to learn, because you need to be able to communicate with your teachers, with your friends during class environment. If you don't have that, the child will not be able to follow the curriculum in the class. Okay, and then on top of it, it will affect them when there is certain triggers that cause their sensory issue, like the loud noise, for example. And yeah, it will affect how they behave in the class, and it will disrupt the class harmony. It will disrupt the class learning processes or learning class. Okay, so what should be done in term of in diagnosing the patient with autism? So when patient is brought to the clinic by the parents, you should go through the checklist of the 2 domains problem, the social communication issue. Even though there is 3 domains, there are a lot of a lot of criteria under those domain to be fulfilled. And then we go through the checklist one by one, because autism is a spectrum. So some of the symptom may be present in certain child, some of the symptom may be more prominent in other child. So some of the children will have more of social communication issue, some of the patient will have more issue with the repetitive or sensory issue. So but and then the management will differ accordingly lah. Those with sensory issue, we will focus on the sensory issue. Those with social communication issue, we will focus the therapy on how to communicate better. So in the end, we have to go through the checklist and go through one by one, ask the history properly, so that we can diagnose them, and we see which component is more prominent, and then we can intervene more effectively lah. So So the intervention when you diagnose child with autism spectrum disorders is basically a lot of therapies. We call it early intervention program. What is early intervention program? Is basically during the age of 2, 3, 4 years old, we send them to occupational therapy, physiotherapy, depends on the problem, and then the therapist will assess them and then will intervene accordingly lah. And then for the sensation, they will try to introduce the sensation they are unable to cope with slowly, and then will when they introduce the sensation problem every day, over the time the child will adapt to it and then will able to handle the sensation better. For example, have sensory issue, you will try to do some intervention involving your sensation, like playing with certain scents, so that they are quite familiar with the sensation. Over time they will can cope better with it lah. And then they will intervene how to communicate better, good eye contact and all that. All this certain activity will promote certain improvement in terms of social communication issue lah. But the main thing, the intervention program should be done daily, like how you go to the kindergarten to school. If you only do once a month, the improvement will not be much. So if you do it every day, then the improvement will be a lot better compared to the children that only attend occupational therapy session once a month, compared to those who go to everyday session lah. Okay, so once they able to handle communication better, social better, sensory issue better, and then they will be able to go to the normal class. Because when we if they able to communicate with teachers and their friends, they should be able to handle the curriculum lah. Because autistic child, they are very smart. Okay, they're not intellectually disabled. Their IQ is very smart, so they are very good. So once they improve in terms of their social communication and sensory problem, they can go to the normal classes. However, if by 5-6 years old they are still not school ready, then they need to go to the intervention class or pemulihan class like PPKI and all that lah. To enter PPKI, they need to have OKU card, because OKU card is needed to go to PPKI class or pemulihan class or pemulihan dalam community lah. Depends on the severity of the problem. The severe autistic spectrum will most probably will go to the PDK, because in PDK, in pemulihan dalam community, their main aim is to teach the child how to take care of themselves. So in any other problem also, like global mental delay, intellectual disabilities, the main thing with aim is basically for them to be independent. The independency is basically to take care of themselves first, like brushing teeth, go bed, clean up after themselves, and then so pakai baju and all that before we focus on the academic part. Okay. However, the challenges in intervention of autism spectrum disorder children, some of the even though I recommend to go EIP every day, but most of the hospital are unable to provide the service every day. The most frequent one should be around 2 weekly. They are unable to provide the thing every day because of the sheer number of patients, because OT also involved in adult patient as well, so they are unable to really provide services every day. So the next option is for private early intervention program. However, it can be quite costly. If they go every day for once a month, maybe it can cost around 500 to thousands, depending on patient problem lah. However, if patient are unable to afford it, so they still only have to go for the OT in a government hospital. So it's still better than not going for occupational therapy at all. Last but not least, some other disorder that fall under autism spectrum disorder include your PDD NOS, or pervasive developmental disorder, not otherwise specified. And then also include your CDD, childhood disintegrative disorders. And then lastly, two more, your Rett's disorder, and then lastly your Asperger's syndrome lah. So I'm not going to explain a bit further lah, because those are very specific category, then they have their own criteria as well.